It turns out that using a couple of different ingredients that work in different ways is way more effective than just using one.
And these are the heavy hitters. Retinoids, which come from vitamin A, are amazing at helping to unclog pores. They're often paired with something like benzoyl peroxide, which kills bacteria, or maybe a topical antibiotic. Azelaic acid is another fantastic option because it kind of does it all. It tackles inflammation, bacteria, and that skin cell buildup.
Now, if the acne is more severe or really inflamed, your doctor might add an oral antibiotic into the mix. But the key here is that it's for a limited time, usually about 3 to 6 months. The goal is just to get that inflammation under control while the topical treatments get to work for the long haul.
But what if the topicals just aren't cutting it? Well, for true hormonal acne, especially the kind that clearly flares up around your period, we have to go to the source. And this is where treatments that directly target the hormones can be an absolute game changer.
And this quote really highlights a star player in this field, a medication called spironolactone. What it does is it actually blocks the androgen receptors right in the skin. So the hormonal message gets sent, but it never gets delivered to the oil gland. It's like putting a block on the mailbox. And the data shows just how well this can work. I mean, look at these results. When you add it up, a full 85% of women in these studies saw their acne either clear up completely or get significantly better. For a single treatment, that is an incredible success rate. So, we have all these great treatments, but there's one more really crucial piece of the puzzle we have to talk about, and that's managing our expectations. This is the reality of the journey to clear skin. Okay, let's be really honest here. There are no overnight cures for acne. It just doesn't work that way. Every single effective treatment takes time and, just as important, consistency. The goal is steady progress, not instant perfection. One of the biggest mistakes I see is people giving up on a treatment after just a few weeks, often right before it was about to start working. So this is a really helpful guide to keep in mind. For topical treatments, you need to give them at least 6 to 8 weeks to see a real difference. For oral antibiotics, think more like 3 months. And for those hormonal therapies like spironolactone, you've got to give them a solid 3 to 6 months to really see what they can do. Patience is truly everything here.
And once your skin is clear, the job isn't quite done. The last step is working with your doctor to figure out a long-term maintenance plan, which is often something simple like a topical retinoid. This is what's going to prevent new breakouts from forming and keep your skin clear and healthy. Look, just understanding the why behind your hormonal acne is a huge first step. The next and most important one is to talk to a healthcare professional who can look at your specific skin and history and guide you to the right treatment plan. Your journey to clear skin is so possible, and it really starts with taking that first informed and patient step.